We're in the month of October, which globally is recognized as the Breast Cancer Awareness Month. We thank the WHO and even all organizations, NGOs that are active during this period. This is because awareness of the condition will make people to come early to the hospital. Hopefully, they will overcome the other factors that make them to come to the hospital very late, including lack of fund, lack of insurance, and fear of treatment, especially fear of removal of surgery. We want to make it clear that it's not all the time that the breast lump that a man or a woman has will turn out to be cancer. It can be non-cancerous at the end of the day, so that just removing the lump will be all the treatment that the individual will need. We can then encourage the individual to undergo screening method. If less than 40, to undergo ultrasound regularly as prescribed by the doctor. Or if it's more than 40, depending on whether there's family history of breast cancer or not, mammography can be done, like X-ray of the breast. So it is important that we overcome the challenges of presenting early, of presenting late, or the challenges we have that may make us not to present early to the hospital. Finances, we hope that health insurance scheme will incorporate care for breast cancer so that people will come on time. Having come to the hospital, there is always fear. And like I always say, is only somebody who has undergone who has had treatment for the disease before that can cancel another individual. The doctor will be able to cancel, the nurses will cancel, but if you have other patients who have undergone treatment before, they can encourage one another to encourage the individual, oh, that I went through this treatment and here am I today. I have survived, that individual has survived breast cancer for 20 years, 25 years. We have them around, people who are considered as being cured from breast cancer. Let us therefore not be afraid to present to the hospital. We need support of individual, support of society, and support should start from the family, that the family members will support the individual who has a breast lump. There's support in terms of the disruption that treatment will cause to the individual, disruption in terms of daily life, daily lifestyle, taking care of the home, taking care of the children. There's also that fear that, oh, will my husband uh, start looking outside once they think I have breast cancer, without cause infidelity in the home? All those fear may always be there because we are all human beings. But with good support therapy from individuals who are well trained for psychotherapy, they will help us in this regard. We have psycho-oncologists, people who are trained to provide support for people who are suffering from cancer, not only breast cancer. Let us make use of what we have, and we hope that our government will put in place the system we need. Thank you. Good evening, good day, wherever you are in all parts of the world. We want to talk about breast cancer because we're in the month of October that have been dedicated for breast cancer awareness globally. What we want to discuss is a challenge that medical doctors, surgeons, and all health personnel sometimes face, and which patients can also share with in order to be able to manage the situation. There's something we call uncertainty in medical practice. That's a degree of uncertainty in some situation, whether one will be able to make a diagnosis of breast cancer in a patient or not when we see the patient initially. The woman herself, to start with, does not know whether she has a breast cancer or not. This is what causes the individual patient to come late to the hospital. But such delay is not um, encouraged in any way. It's better that we get to be certain. So when a patient sees a medical doctor, the medical doctor will take what we call history, we interview the patient and try to find out the history of the patient. Is there any family history? When did the lump start growing? The patient should tell the truth with the length of growth of the lump. What the skin changes, any nipple discharge, how many children the individual has, when did you have the first menses, menarche, or the individual stop menstruating. I would like to know whether there's family history of breast cancer. All these questions, whether there's past use of hormonal contraceptives, all these questions were usually asked to help us in clearing the uncertainty we may have in diagnosing breast cancer. Then we will examine the patient, usually with a chaperone, a female chaperone. We are examining a female patient. If examining a male patient, a female doctor examining a male patient may require to have a chaperone as well to protect both the doctor and the patient in this circumstance. So, uncertainty after examination, after interview, there may still be uncertainty with respect to the cause of the breast lump. That is what then leads us to take a biopsy. There are different types of biopsy, but the one that we advocate nowadays is not even the open biopsy. We use a needle that is bigger than the needle we used to use in the past, that we take cut tissue, and when we take it to the laboratory, the degree of uncertainty will be reduced so much that with that tissue that we have taken, we can tell all the type of breast cancer, the type of medical therapy the patient can undergo, and the precision medicine we can give to the individual. So science have reduced the degree of uncertainty that we used to have in managing people who have diseases and breast cancer. We therefore encourage people to come to the hospital on time. Let us not encourage lateness in presentation. Thank you very much. Bye bye.